On April 21st, 2025, the Department of Health and Human Services, HHS, led by Robert F. Kennedy Jr., terminated the largest study on women's health in the United States. I'm Christine, reporting and narrating for Crystal, STEM Now's anthropologist, STEM education researcher, and a political activist. In 1991, the late Dr. Bernadine Healy, the first woman NIH director, announced the establishment of the Women's Health Initiative, WHI, which would focus on major illnesses and issues of wellness that impact women, especially women over the age of 50. In her testimony in front of Congress, she said, quote, "We need a moonwalk for women," unquote, and that is exactly what she gave us. The Women's Health Initiative led a groundbreaking long-term national health study on women's health funded by the National Institutes of Health, NIH. The WHI studied the prevention of heart disease, breast and colon cancer, and bone fractures from osteoporosis. The WHI also investigates key women's age-related health conditions such as frailty, vision loss, dementia, mental health, and social isolation. The WHI has shaped clinical practice and public health policies for women in the United States. In addition to its main center in Seattle, Washington, the Women's Health Initiative has regional centers located in New York, North Carolina, Ohio, and California. About 162,000 women ages 50 to 79 across the United States enrolled in the WHI's studies in the mid-1990s. Over 42,000 participants ages 78 to 108 remain actively involved today. WHI researchers have documented over 38,000 cancer cases, 38,000 heart attacks, strokes, and heart failure, 70,000 bone fractures, and 95,000 deaths. WHI's research has helped reduce rates of cancer and other diseases for women, influencing clinical guidelines for numerous health conditions that women experience. This resulted in an estimated $35.2 billion in savings in medical expenses for the decade following the release of the trial results. The WHI is best known for a study of hormone replacement therapy that was abruptly halted in 2002 after researchers found that while older women who took a combination of estrogen and progestin had reduced colorectal cancer and hip fractures, it put them at a higher risk for heart attacks, strokes, and blood clots, and that they experienced a small but significant increase in the risk of breast cancer. Why did the NIH decide to focus on studying women's health in the 1990s? There had been no specific studies of women's health prior to the 1990s. Most clinical research conducted involved men, and the findings were extrapolated to women. Prior to 1993, women of childbearing potential were excluded from the early stages of drug trials due to a 1977 FDA policy recommendation based upon the tragic results of the use of thalidomide. Thalidomide, used by pregnant women, had caused infant deaths and birth defects. Between 1986 and 1993, inclusion of women in clinical research was NIH policy, but it was not law. In 1993, Congress wrote the NIH inclusion policy into federal law. This policy mandated that women and minorities must be included in clinical research funded by NIH. If women and minorities were not included in proposed research, researchers were required to scientifically or ethically justify their exclusion. For example, if a researcher is studying prostate or testicular cancer, they can, of course, justify excluding individuals assigned women at birth because they do not have prostates or testicles, but they cannot justify excluding men of minority populations from their study. Another example is that if a researcher is studying heart disease, they have to include women and minorities in their study population. If they decided to exclude them, they would have to provide scientific or ethical justification. In an April 22, 2025 issue of Science, Joanne Manson of Harvard Medical School and Brigham and Women's Hospital, one of the long-term principal investigators of WHI, described Kennedy's decision to terminate funding a, quote, devastating blow to the health of all older adults in the U.S. and throughout the world, unquote, adding, quote, "No study is a better example of the enormous scientific impact of research on the prevention of chronic disease in the population, one of the stated priorities of the HHS leadership," unquote. When the New York Times broke the news about the termination of the WHI funding, Kennedy claimed on X that it was, quote, "fake news," unquote. However, in response to bad publicity and outrage from politicians, celebrities, and scientists at the termination of funding, a Health and Human Services spokesperson claimed that NIH was working to restore funding. We are pleased to report that on May 6th, WHI reported that NIH informed the leadership team that the decision to rescind funding had been reversed so they continue their work uninterrupted. We encourage you to keep the pressure on your elected representatives as well as the NIH. Contact them directly, letting them know that you support the restoration of the WHI funding. Political activism and publicity are responsible for Kennedy reversing course. We need to keep it up, be engaged, and talk to others in your community about how their health is being negatively impacted by Kennedy's decisions. Thank you for watching. Please subscribe to this channel, like and comment on this video. Thank you.